Welcome to the Strategic Planning webinar in the series presented by AGPAL QIP on behalf of the Victorian Tasmanian PHN Alliance. This webinar, we're going to be talking about practice planning. My name is David Osman. I'm a healthcare practice manager. I work across a number of general practices based in Melbourne, and I'm very pleased to be joined by Gary Smith. Gary Smith is a practice manager who's been working for 36 years, managing a 12 doctor-owned general practice at the foot of the Blue Mountains in New South Wales. Welcome, Gary, to this webinar with me today.
Thanks very much, David.
I'd just like to start by acknowledging the Aboriginal and Torres Strait Islander peoples as the traditional owners of the land. We wish to pay our respects to elders past, present and emerging, and acknowledge the important role of Aboriginal and Torres Strait Islander people continue to play within our community. This webinar has been developed by Eastern Melbourne PHN on behalf of the Victorian and Tasmanian PHN Alliance, which is a collective platform of 7 PHNs in Victoria and Tasmania. The webinar was made possible with funding from the Australian Government Department of Health. The Commonwealth of Australia, Eastern Melbourne PHN and the participating Victorian and Tasmanian PHNs do not accept any legal responsibility for any injury, loss or damage suffered as a result of the use, reliance upon or interpretation of the information contained in this webinar. This webinar is to be used as a guide only, and practices should read and refer to the tools and templates available when developing their own strategic plan. So let's kick off with talking a little bit about what we set to achieve in this webinar. We plan to provide you with information and knowledge to assist in, first of all, identifying the key elements of a strategic planning framework, creating strategies for data collection, analysis and planning to optimise the practice strategic planning, and to understand sustainable business opportunities through prioritising resources for revenue. We're going to take a deeper dive into the framework of a strategic plan. We're going to be looking at undertaking business analysis. We're going to be looking at what is strategic thinking. We're going to be talking about goals and strategies, and we're also going to be thinking about engagement of the team and our stakeholders. The first thing in developing a strategic plan is really making sure that you have in place a solid framework that's fit for purpose in your practice. Obviously, frameworks come in a range of different sizes, but the main thing is to not try and overcomplicate the structure. Keeping it simple is an important part of a strategic plan. You need to be able to develop a plan that is adaptable as well as the things in the healthcare practice we need to be aware of. We also need agility to adapt to changing circumstances. Business plans are also important, but we shouldn't get confused between the two, because the different purposes of these tools and their use in the practice are absolutely essential. Business planning is about the details you need for a set period and how to use or intend to use those tools in the context of operating your practice. Business plans, however, can't really be developed without a strategy, a purpose, and of course agreement by all the relevant members of the practice team. Business plans are important for effective and sustainable practice operations, and they also assist with compliance. For practices in general practice, business plans are also a way of demonstrating your ability to make accreditation standards. Specifically, indicators Core 3.1A and Core 3.1B in the current edition of the RSEGP 5th edition standards outline business planning requirements. Business plans include the what, how, where, why, and who is going to action. For your practice to have a good strategic framework, you also need to consider the elements of that plan. These are probably going to include the business's purpose, vision, values, and the strategic fit, goals and targets, stakeholder engagement, drivers of the plan. For all of these, the most important is developing your purpose and aligning that with the vision of your practice. These two key elements will help shape the rest of the framework and let you evaluate whether your strategy works. Gary, I might get you to chime in there on the framework.
Thanks, David. Most important part, I think, of the framework is the practice's vision. Setting the practice vision is our reason for being. Why are we here? We need to remember the importance of our stakeholders on our strategic plan, and they are our owners, our staff, and our patients. Never forget about our patients, because that's our reason for being.
Absolutely. Thanks, Gary. That's a really, really important point when we're talking about the framework, thinking about all of those things in context. So once you have developed that overall direction and purpose, you'll need to consider all of the elements in that planning process. The next step is critical for a number of reasons, because most importantly, without accountable timelines and responsibilities, the plan isn't going to be able to be realised. In the context of business healthcare practices, you need to ensure realistic timelines are going to be an indicator of how you succeed. Timelines need to be realistic, but you should challenge yourself a little bit, as the end goal of having a strategy is always about growth and sustainability. The thinking process in the strategy is also a really important component here. So you should be thinking outside the box. Maybe that outside box thinking is something that is key for your practice to be able to stand up against other practices, whatever competition you might have in your particular field. The next really important component for a good strategy is ensuring that you do a thorough business analysis. And business analysis really involves us looking at the data collection, reviewing of information, and sometimes it may even involve doing some research outside of what you already know. Do you know your patient base really well? It's an important question to be asking yourself and the practice team, because your strategy needs to evolve around that. Have you got a really good handle on the needs of your community? Are the services you're delivering going to align with that? Data is obviously going to be a very important guide to questions that you should be asking when you develop your strategy. So it's important that you develop ways to collect data as you go. This is going to be an important part of that continuous education and evaluation process that happens, and it's going to be a key to seeking improvements. And a good strategic plan is going to be one of those things that develops some of those key improvements as you go along. For existing practices, patient data analysis is going to be a key tool for understanding those patient needs. You might want to be thinking about talking with the PHN around data analysis. There are a number of tools available, for example, PenCat, Polar, and Medical Director Insights. And the PHNs have access to be able to assist you with some of those tools if you haven't got them in place already. If you do, you might want to talk to them about how to make best use of those tools when you're developing your strategic plan. So reach out to your PHN. They can be extremely helpful in this process. When you've got a strategy around your practice's direction and you have data to tell you about the needs and demands of your patient base, clearly the next logical step is to think about the strategies for your business. Strategic thinking is a simple way as being able to use information and brainstorm to develop goals and strategies. Thinking outside the box and being creative will be vital for developing the competitive advantage you may need against the practice environment, or whatever your point of difference might be for your practice. Gary, do you want to give us a comment about your point of difference?
Thanks, David. I think my question to you all is how well do you know your practice or your services? In this day and age, I think, what is your point of difference? What do we do well? What services or products do you think your stakeholders might need? But you need to remember in strategic thinking that stakeholders may not know what they don't know. Maybe you need to tell them what they need.
Thanks, Gary. And I think that really importantly to thinking about this whole process is key to using data and information you have available. So you start that questioning process, you start talking about and thinking about what are the elements that your practice can use, what are some of the strategies that support that. Ultimately, thinking about the questions around what is your advantage against other practices in the healthcare sector more broadly. Also thinking about the ways in which you can use your abilities to grow in the strongest capacity that your practice has. When you're thinking about, as a practice team, creating new opportunities, you should also be challenging yourself and the practice team to think about ideas that are unique, that set you apart. And I think that opportunities that are value-based are going to give you the best understanding around the engagement between your practice team and the community and patients that you connect with. So whatever you come up with, the key thing about strategic thinking is to make sure that you have goals that have a purpose and they continue to link back to your practice vision and values. They're a really important part of the overall strategy, having those things in place that continue link back to what is the vision for your practice and what are the values that you set as a practice team that everybody in your practice will live by. So we think about goals and strategies and the ways in which we might incorporate this into our strategic plan. A solid strategy will have goals associated with it, and it will, as we were talking about vision before, that will be reflective here in the vision of your practice. It's important, I think, here to consider some of the opportunities that you might come up with and put them into some context, really, and thinking a little bit from a business perspective around sustainability, but also where it links into the values and the approach that your practice might have towards some of these business opportunities. All new business opportunities are going to obviously come with an element of growth, but they also need to have value for money. So we're not going to just invest most likely in our practices in something that doesn't have sustainability and be value for money. And we need to consider those things when we're using the resources that are available to us in our practice team, or even if we're expanding the use of other resources as well. One tool that you might consider here for defining your goals is the concept of SMART goals. And SMART goals are very much about being specific, measurable, achievable, realistic, and timely. And a SMART goal is something that you will take into consideration that structure, the well-rounded approach to communication with your team. And it's something that I think for many practice teams with using these types of tools, it's something that's got some attainability around it, and it's got something that people can clearly articulate and understand. They know what the goal is, they know what it's trying to achieve. And I'm just thinking here about some examples of those things, but certainly some of the goals and strategies that I'd be looking to is where you might want to increase your revenue, whether it's through introduction maybe of a new doctor or specialist in your practice, and you may have an achievable goal there of whatever that revenue might look like, and you might put a number around it or a percentage around it, and you would incorporate all of those things into the goals as well. There's also other considerations that you might consider as goals, and they could be introduction of technology, for example. I know from one of my practices in the last couple of years, we've seen a massive introduction of technology for things like recall and reminders through SMS. I'm sure, Gary, you've got experience with these things as well. They're very important tools that we can use to align with our strategy and the values of the practice, but they also have a money element around improving efficiency and growing the business and value that we can get out of it. We want you to be thinking about how to use these goals in developing your strategy. And so, as I mentioned before about examples of some of the ways that you might think about that, whether it's increased revenue or introduction of technology. After this webinar, we really suggest that you take some time to come up with strategies. There's no point in thinking about a strategic vision for your practice, but not putting it in place. So when you've finished going through this process and you go back to you, take a few minutes in your practice to think about maybe developing a couple of strategic goals. Make sure when you do that, that you think about how sustainable they are going to be for you to implement. What are the capacities for growth, obviously within the practice team, and using these goals to build them? And are they going to return value for money? And we talked before just about SMART goals briefly, but you can see there just a bit more of an outline of what a SMART goal looks like. So you may want to employ that framework. Obviously, there are a number of different ways that you may wish to implement goals development, but that's a simple and easy way that I've used to think about how a goal might be achievable in our practice. So you've gone away and developed goals, but then that's only partway through the process. We've got to be thinking about engagement. Engagement's a massive part of how we might be able to implement our strategy in our practice. And without engagement, obviously, we're potentially not going to see any return, and we're not going to see those things implemented. Engagement in the strategy is an absolutely essential component, I think. And so even knowing it comes after developing whatever your goal and strategies look like, the engagement part is really probably only the only part that you don't have to develop right on at the beginning. But if you don't implement before you try and put your strategy in place, you're unlikely to see success. For the practice team to be engaged in the process, you've got to come up with good results, and their efforts need to be obviously understood and acknowledged. And so going through an engagement process is something you can consider only at the end of developing the goals, but before you start implementing things with the patients or the practice team, because it's absolutely essential. And sometimes that engagement is within your team, but other times it involves potentially discussing with patients and clients their involvement in some of your practice's processes. It might be other stakeholders that you engage with. So in general practice, some of your goals might involve other types of practices, allied health and specialists. And so you may want to engage with them. And that works across all parts of the healthcare sector as well. For a good strategic plan, it's really important that not just the owners of the practice are involved in that process, but everybody. And so for me, this is something that I find when we need to implement a new strategy in our practices and our business, we talk about it obviously at a leadership level, but then we need to distill that down and talk with our team about how that's going to work. What are the types of things that they might see as being of value to the strategy, and what are the things that they think will be the success of whether it's implemented or not. Some of the ways that you might go about that could be simply just having a team meeting. If you're implementing a lot of change, the frequency of that might be quite often. So you may need to get together in a big project every morning for a huddle or some other type of get together to discuss the progress of implementing goals and your strategy. For other things, it might be just taking time outside of the practice to get together in an environment where people can freely share information, talk about the strategies and how things are going, and give valuable contributions to making things be implemented in a value-based way. An important part of that engagement is really developing, I guess, a sub-strategy, if you like, of who you're going to engage with, how you're going to engage with them. So documenting all of the elements of your engagement are going to be an important way of tracking it. That can potentially involve all of the practice team members. It can involve members, as we said, externally to your practice and organisation. But critically, in order to have an engagement plan, you need to create some process around ownership. And whether it's the practice manager or practice owner or other people involved in the business, someone needs to hold courage of making sure that that engagement plan can be implemented. And a good way to do that is to start thinking about putting together a plan for action. And I'll come back to that in just a moment. It's absolutely important to think about external factors. As we know, not everything evolves around just the people that are enacting the plan. So sometimes when we're putting together a strategy, we need to think about bringing in external people that may offer a differing point of view or more information that's outside our scope of understanding. That could be talking with your accountant about the financial elements. It could be talking with your lawyer about implications of something you may want to implement. And if you're going into a completely new area, it might involve engagement with someone who is a subject matter expert in that particular field. And I think something we shouldn't underestimate in this particular component is engaging with our colleagues who work across the healthcare sector who may have had experience. I know one of the things that I find as a practice manager that's really important is talking to other practice managers, and I'm sure that's the same for practice owners as well, about some of the things you've implemented, some of the lessons learned, and some of the ways in which you might be able to find out more information about that particular thing you're wanting to implement as a strategy. So I mentioned tracking actions, and that's very important because you need to have a level of accountability with all of the things that you want to put into your strategy. There are obviously plenty of different ways that you can track actions from a business point of view and a planning perspective. But one key thing that's obviously really important is having it documented and making people responsible for elements of it so that you can track, are you following that plan? Where are you up to in achieving what you want to achieve? So this is just an example here, which you can see on the slide, and that talks about a specific goal that's been given as an example. It fits into the strategy for this particular practice to increase practice income through implementing a flu clinic. Obviously, flu clinics in general practice, something that many of you would be familiar with if you work in that part of the sector. This has an example here as well of a SMART goal. So this practice has decided to implement flu clinics to increase income by 20% by a specific point in time. So that goal's measurable, it's understandable. I can see what they're trying to achieve and how they're trying to achieve it. And then it's the elements of who's going to make all of those things happen. So you see in this example here, we track the activities, we track who's going to be responsible for those things, and we track how we're going to monitor them. So in terms of what resources are required, what our potential result will be of that action. And so that action plan is a living document that will continue to keep us responsible and accountable for our practice strategy. So as part of this process, we talk about action planning and we talk about using some of those things. So we'd like you to think about developing a quick action plan to implement some of those strategies that you might have considered. You need to think about when you use that, who's going to be involved in implementing the plan, what resources you think are going to be required, and how is measurable, how is it going to be successful. I think that it's really important when you do this to think about whether you use that template you saw in our example or something else you might be familiar with. There's plenty of resources, and practice managers, being resourceful people, will find different tools and things that they can use. But the most important elements are tracking who's going to implement things, what resources you're going to need, and how do you know if that strategy has been successful or not. It's really about the who, the what, and the how that are really important in the action planning process. So I just wanted to summarize the key things which I think are important from what we've talked about in this webinar. Certainly developing the framework is absolutely essential, and you don't need to reinvent the wheel in terms of developing a framework for strategy. There are tools available to support healthcare practices. So first of all, and looking to what they are, and I'll talk a little bit about some of those resources in a moment. The planning process is absolutely important, and it's important to have realistic timelines. We know that in busy day-to-day managing of your practice, certainly when you want to implement something, you need to make time to do that, but it's got to fit in with overall operations. So from my experience, when I want to implement something in our practice, I give consideration to when we'd like to achieve it, and then have a discussion with the team about how realistic is that to actually achieve. There's no point in me saying we're going to implement that by the end of the month, but we've got 5 other things on our plate at the time. So having a realistic plan, but make it something challenging as well, because you don't want to be too complacent about implementing change and strategy that's important for your business. We mentioned about data, and data can be and is a very important tool. It's something that is going to tell you if you're on the right direction in terms of implementing your strategy. It's also going to give you so much detail around what it is you might want to include in the strategy. So going back to that planning process, having data available to you is going to be an important part of planning and developing your strategies. So if you've got data available before you start the planning process, you've already got yourself a few steps ahead in terms of understanding your patients, your practice, what you're trying to achieve. For new practices, putting in place data collection tools very early on in the process is essential. So when you're planning, you think about all the logistical things when you're opening up a practice or a new business, but putting in place embedding data collection is really important. And we also mentioned in terms of data, don't forget that you can reach out to the PHN for data collection tools and support. PHNs are using a range of different tools to support you, but underlying that, they have people in their teams that are very familiar with data improvement and quality improvement processes using data, so they can be valuable to you. You don't have to do all of that on your own. And you need to think about all of your plannings from a business and a patient perspective. So it's critical when you develop a plan to consult and discuss all the different perspectives. I know that if you're implementing strategies, you're most likely from a manager's perspective thinking about it from what is it I need to achieve in this business, whether it's increased revenue or new services. But don't forget to come back and add that patient perspective in. And I know that a number of strategies that we've thought about in our practice, we've actually got that patient point of view by talking to patients. If you're on a big project or implementing a lot of strategies, you might want to consider having a patient or a consumer input using somebody to come along and run through some of those things with. A lot of businesses do that in terms of when they're wanting to bring out a new product or service, they find out if the market is there for that particular product or service. And the same thing applies in practices as well. Talking to patients about whether those services will be of value to them is going to be an important way of understanding whether there's business sense in doing it. And of course, very importantly, and we talked about it, engagement is key. So if you're going to implement any strategies in your practice, make sure you engage with all the relevant members of the practice team. Don't forget that there are external stakeholders as well that may be involved in that process of engagement. So don't just keep it within you and the practice owners. Extend that out to the entire practice team. Extend that out to other people outside of your practice team if you think it's relevant, or they provide an insight into the process. You want to have team buy-in. Team buy-in is going to be critical to any success of a strategy. So making sure that you engage with all of those people that are going to be responsible for implementing the plan. And Gary, did you want to add anything in terms of your feedback or comments here?
Thanks, David, for a very comprehensive overview of the strategic planning process. I cannot add much more than what you have covered already, but I only wish to make one comment. A plan is not a plan unless it is implemented. Your plan will never be a perfect plan, but what will make it successful will be the ongoing of revisiting and refining the goals within your plan.
Thanks, Gary. And that's a really important thing to leave on in terms of some of the strategy and things we've been talking about. It's absolutely critical for us to think about and reflect on these things as we develop the process. Just before we go, I'll touch on a couple of resources that may be useful for you in terms of implementing business and strategic planning processes. So there's some links here, and you'll be able to click on those links. They're available in this presentation. AgPal have a business planning page dedicated on the website that provides resources and some information to you about certainly the relevance of planning in accreditation, but also in running of your business. The RACGP have a number of links within their general practice management toolkit. And I might say that these aren't just relevant for practice management in general practice, they are relevant across all elements of the healthcare sector, but they've been developed by the RACGP. So I'd still encourage you to have a look at those. Obviously, standards for general practice will reflect back on the things we talked about in terms of the business planning element, but always refer to the standards as a really important way back to making sure you're compliant and knowing the things you need to have in place. And the Australian government have got a fantastic business planning template. Obviously, business planning is one of the components we talked about, but the planning template then takes you on to think about strategic planning and the elements that you need to have in your overall strategy. So that's a really important and useful resource as well. There are a number of things though you can find online about strategic planning in healthcare practices. So these are just a few examples to get you started on that journey if you don't have one in place already. So that completes our webinar on strategic planning. If you have any feedback or future support about this webinar, you should direct that to your PHN. They've got people in their teams able to support you and take you through all the resources and support that you might need. So thank you very much for joining us on this webinar about strategic planning. I thank Gary very much for joining us and providing support throughout on behalf of AgPal and QIP and the PHN Victorian and Tasmanian Alliance. Thank you for joining us today.